In this video, we're going to talk about the biomechanics and to fix the reverse and the forward lunge. So a lot of times what people do is they butcher the movement. They don't necessarily do it right, and obviously it's going to result into pain. So what we're going to do in this video is we're going to talk about the two big dysfunctions, the compensations that we typically see within the upper body and the lower body. So we already know that if we do things not necessarily with the optimal technique, it will result in pain. It might not necessarily do it from the beginning, right from the front, but over time, those are the things that we don't want to happen. Again, we want to train pain-free. So taking these techniques and making sure that we're doing them with superior form, internal tension, these are going to help your body in the long run. So what we're going to do, Gregory's going to go into a half kneel position. So we're going to start off with the lower body first. So many times what people do with the front leg, so this is the front leg, either if it is a forward lunge or if it is a backward lunge, a lot of people, what they do is they go into a valgus collapse in the knee. So when they go into the reverse lunge or the forward lunge, the knee ends up looking something like this. So what we don't want that to do is to potentially put so much force now on the outside part of the knee, because that's typically what happens when people go into a valgus collapse. It changes the Q angle at that knee joint, basically looking at the hip, in line now with the femur at the end, and then from there changing that whole dynamics of the knee joint and the patellar bone itself, or the patella bone. So what we want them to do, a lot of times we can actually change the Q angle just by dramatically activating our glute muscles. So we can go now pushing out the knee. So when we get into this, pushing out. Gregory, where'd you feel that?
Right here.
So we're feeling that now within the glute area. And again, our strongest external rotators are our glute muscles. But again, at the same exact time, we don't want to go into too far out. So now we kind of look like this is a totally different type of movement. This isn't necessarily going to look like it's going to be a lunge. So from here, we want to keep the neutrality within the whole complex of the hip. And that's my biggest thing, is I always say the knee should be in line with the femur right at the highest point all the way up into that hip capsule. So now from here, we're going to go into our second portion, which is now kind of looking at that back leg. So I'm going to have Gregory kind of just face either that way. Perfect. So now taking a side step, just kind of let the sit thing. We're going to now go into a split position. So what I typically see within our reverse lunges or even forward, people go into excessive reaches. So typically what they're going to do, they literally reach so far back so that when they end up getting into this position, it changes the dynamics of our lumbar spine. Again, compensations start to happen in surrounding areas. This for a standard regular movement. Again, movement patterns are supposed to be sufficient enough that we can keep progressing up that pyramid. So typically when people take too far a step back is now their extension of their hip doesn't necessarily have the range that we want. Again, 10 typically is kind of average of what we want, but we know with common society, we don't necessarily have that extension of 10. So now the other thing that we typically see in these positions is too narrow. People don't take a far enough step backwards to go into that. And times what people do is they go so far forward that it literally changes the way that their knee operates. So we know that if we literally get into this, and you can actually see in the back of the video a little bit, his literally heel now comes off of the ground just because the ankle joint now has to go through more excessive range of motion to get the job done, and putting more now shear forces at the knee joint, and we don't want these things to happen. So typically what I always have everyone do is to find that safe position. We just go into a standard half kneel position. So Gregory, I'm just going to have you just simply show everyone a standard half kneel position of how you would make your basically reverse lunge. So now if I kind of want to look into this a little bit, there is the little bit of separation from the back of his heel to the front of the knee. There is that change. It's not excessive, it's not too far back, and it's not too far narrow in that full position so his knee's really far forward. Again, he has that slight change a little bit. But now we're going to kind of change the transition over into our upper body. So Gregory, I'm going to have you kind of face this way a little bit in the video. So now what we're going to have you do, I'll bring this knee pad over for you. Let's go into a half kneel position. Perfect, bring that down there for you. So a lot of times what people always do is when they get into these positions, they get into too much of a vertical format. When you do a reverse or a forward lunge, you do want to have a slight lean forward in your upper body, in that torso region. Because as we get into this whole position, now we start to make up in that lumbar back or that lumbar spine a little bit in the low back, and we put more pressure now on the anterior portion of the spine, then and there, potentially pinching our nerve roots in that area and resulting in pain. So other things that we typically see is people now, we only want a slight lean forward, but if you get an excessive lean forward, people typically even lose like their posture. So now we can even see lumbar back actually starts to round forward a little bit more. And even at the same time, we get unwanted rotation. So what people typically do is they kind of lean towards that front leg a little bit. They rotate their body and then change the dynamics of the spine, change the whole dynamics of the movement in general. So now what we are going to do, we're going to show you guys the perfect lunge. We're going to go over forward and we're going to go over backwards. So first, to actually already get this even started, we're going to go into now CV3. So we want to create tension. We want to do co-contraction. We want to breathe in through our whole respiratory system, brace that body, and we want to dial back a little bit. So give it 100%, but then dial back about 25%. If you want to learn more about this, go to our video for creating internal tension in our article as well. So, Gregory, let's go into this overall, creating that tension that we want. So starting from the ground up, create that contraction of our glutes and our adductors, lats, now punch the ground, our chest. Take that big breath in, brace that body, dial back a little bit, and now he's going to perform that perfect reverse lunge. Let's do about 2 repetitions on each leg and then go forwards as well. So perfect, he's got that forward lean, exactly what we want. So when he's doing these positions, now you can see his knee isn't collapsing in. He's maintaining the whole neutrality of the whole spine. His head isn't dumping forward. He isn't doing any unwanted rotation. Again, contracting the glutes, keeping everything in a perfect position. Let's go forwards a little bit in these positions. So again, sagittal plane motions. Again, he's slightly leaning forwards. Kind of pauses a little bit at that bottom. That's perfect. Again, looking, he's not collapsing in here. He's not excessively reaching forward. And that's what we want. We want these positions to feel comfortable, just in a standard body weight movement. Again, master the simple things first. Master the body weight, then add some external load to make this a little bit more of a challenge. But make sure that we are doing these things right. Again, as we mentioned, typical dysfunctions that we see are going to be our upper body region, and then we're going to see our lower body region as well. So we typically see the knee kind of cave in, we see too far step backwards, too far forwards, and then now in the upper body, typically what we see is people are really vertical, they don't necessarily lean forward, or they lean too far forward, and they rotate a little bit. So making sure that we watch out for these things, optimize movement first. I hope this video helped you guys out on trying to get the better technique for your reverse and your forward lunges.